What if I told you about some of the bathroom habits you've had for decades? Things you do every single day without thinking are actually damaging your prostate and making your symptoms worse. I'm Dr. Nerita, and in my 12 years as a urologist, I've discovered that many men over 60 are unknowingly sabotaging their prostate health with simple bathroom mistakes that seem completely harmless. These aren't just minor issues. These mistakes are contributing to the weak stream, the constant urgency, the midnight bathroom trips, and the feeling that you can never fully empty your bladder. But here's the good news. Once you know what these mistakes are, they're incredibly easy to fix. Before we dive in, do me a quick favor. Hit that like button right now. Drop a comment telling me where you're watching from, and make sure you're subscribed because what I'm about to share could dramatically improve your quality of life starting today. Let me tell you about a patient who was making every single one of these mistakes. His name was Walter, 71 years old, former airline pilot, a man who'd spent his career making split-second decisions and maintaining absolute control. But when he walked into my office, that sense of control was gone. "Dr. Nerita," he said, his voice tight with frustration. "I feel like my body is betraying me. I'm in the bathroom constantly. I wake up 4 times a night, and when I do go, it takes forever to start. The stream is weak, and I never feel like I'm really done." He paused, looking down at his hands. "I used to fly 747s across the Atlantic. Now I'm afraid to drive across town without mapping out every bathroom stop. It's humiliating." I've heard variations of this story thousands of times. Men who feel like they've lost their independence, their confidence, their dignity. And here's what breaks my heart. Many of these men are making simple bathroom mistakes that are actively making their prostate symptoms worse. They think they're doing everything right. They're following what their fathers did, what they've always done, what seems logical. But unfortunately, some of the most common bathroom habits are actually the worst things you can do for an aging prostate. When I examined Walter and asked detailed questions about his bathroom routine, I discovered he was making 6 out of the 7 mistakes I'm about to share with you. And here's what happened when we corrected them. Within 2 weeks, his nighttime bathroom trips dropped from 4 to 2. Within 6 weeks, his daytime urgency had improved by about 60%. Within 3 months, his urinary flow had strengthened noticeably. And he told me something that stuck with me. "Dr. Nerita, I didn't just get better at urination. I got my confidence back. I got my freedom back. I'm not afraid to live my life anymore." That's what we're really talking about here. Not just bathroom habits, but quality of life, dignity, independence, the ability to live without constant worry and limitation. Before we go through the 7 mistakes, let me quickly explain why your bathroom habits matter so much for prostate health. Your prostate sits right below your bladder, surrounding your urethra like a donut around a straw. When it enlarges with age, which happens to most men, it puts pressure on that urethra, making urination more difficult. But here's what most men don't realize. How you urinate, when you urinate, and what you do during urination can either help or harm this already challenged system. Improper bathroom habits can increase inflammation in the prostate, weaken your bladder muscle over time, create incomplete bladder emptying, leading to infections, worsen the mechanical obstruction from BPH, damage the delicate tissues of your urinary tract, accelerate the progression of prostate enlargement. On the flip side, correct bathroom habits can reduce strain on your prostate, improve bladder emptying, decrease inflammation, strengthen urinary function, reduce symptoms significantly, improve your overall quality of life. The 7 mistakes I'm about to share are based on neurological research, clinical experience, and what I've seen work for thousands of patients. Some of these will surprise you. Some might seem counterintuitive, but all of them are backed by solid medical understanding of how the prostate and urinary system actually work. Let's go through each mistake one by one. Pay close attention because chances are you're making at least 2 or 3 of these right now. Mistake number 7, urinating while standing. I know this is going to be controversial, but hear me out. For men over 60 with prostate enlargement, standing to urinate is actually putting extra strain on your system. The biological impact. When you stand, your pelvic floor muscles are partially engaged to maintain posture and balance. This creates tension that works against the relaxation needed for complete bladder emptying. Your prostate is already creating resistance. When you add pelvic floor tension from standing, you're making your bladder muscle work even harder to push urine through that narrow opening. Over time, this extra strain can weaken your bladder muscle, lead to incomplete emptying, increase residual urine, urine left in the bladder, raise your risk of infections and bladder stones. The emotional impact. Standing to urinate often means you're rushing, distracted, or not fully focused on complete emptying. This perpetuates the cycle of frequent urination and never feeling fully empty. The fix. Sit down to urinate, especially at home and at night. When you sit, your pelvic floor muscles can fully relax. Your bladder can empty more completely with less strain. Studies have shown that men with prostate enlargement empty their bladders more fully when sitting compared to standing. I know this might feel awkward at first. It might feel like you're giving up something masculine. But trust me, there's nothing masculine about struggling with prostate symptoms when a simple position change could help. Walter, the retired pilot, was resistant to this suggestion at first, but once he tried it for a week, he noticed a significant difference. I actually empty better, he told me, and I'm not waking up as often because there's less urine left in my bladder. Mistake number 6, rushing through urination. Most men treat urination like a race. Get in, get out, get back to whatever they were doing. But when you have an enlarged prostate, rushing is one of the worst things you can do. The biological impact. Your bladder muscle needs time to contract fully and push all the urine out against the resistance of your enlarged prostate. When you rush, you don't allow complete emptying. This means residual urine stays in your bladder. You feel the need to urinate again sooner. You're at higher risk for infections. Over time, your bladder muscle weakens from never fully completing its job. The emotional impact. The irony is that by rushing, you actually create more bathroom trips throughout the day. You're trying to save time, but ending up spending more time in the bathroom overall. The fix, take your time. Allow at least 45 to 60 seconds for complete urination. Here's the protocol I teach my patients. Sit down and relax completely. Don't push or strain. Let the urine flow naturally. When you think you're done, wait 10 to 15 seconds. Lean slightly forward. This gentle change in position often releases more urine. Wait another 10 seconds. Stand up slowly and carefully. This technique, called double voiding, helps ensure you're truly empty. Yes, it takes an extra minute, but that 1 minute saves you multiple trips throughout the day. Mistake number 5, pushing or straining. When your stream is weak or slow to start, the natural instinct is to push, to bear down and try to force the urine out. This is one of the most damaging mistakes you can make. The biological impact straining creates enormous pressure in your abdomen and pelvis. This pressure damages the delicate tissues of your bladder and urethra, can weaken the bladder muscle over time, increases your risk of hernias, can worsen hemorrhoids, puts stress on your pelvic floor, may actually make it harder to urinate by creating more tension. Chronic straining is like revving your car engine while the brake is on. You're creating effort without effective results, and you're causing damage in the process. The emotional impact. Straining makes urination feel like work, like a battle. It turns a natural bodily function into a source of stress and frustration. The fix: never push or strain ever. Instead, sit down and relax completely. Take slow, deep breaths. Give your body time to initiate the flow naturally. If nothing happens after 30 to 60 seconds, stand up, walk around, and try again in a few minutes. Sometimes a change in position, a glass of water, or just waiting a bit allows your system to relax enough to urinate naturally. If you consistently cannot urinate without straining, you need to see a urologist immediately. This could indicate significant obstruction that needs medical intervention. Mistake number 4, ignoring the urge and holding it too long. I know you've heard that you shouldn't hold your urine too long, but many men don't realize just how damaging this can be when you already have prostate issues. The biological impact. When your bladder overfills, the muscle stretches beyond its optimal range. This chronic overstretching weakens the bladder muscle over time. An overfilled bladder creates more pressure against your already enlarged prostate. This increased pressure can reduce blood flow to the bladder wall, leading to inflammation. You're at higher risk for Urinary retention, inability to urinate at all. Think of your bladder like a balloon. Stretch it slightly and it springs back to shape. Overinflate it repeatedly and it loses its elasticity. The emotional impact. Holding your urine for too long often stems from fear or inconvenience. Not wanting to interrupt a meeting, not wanting to stop the car, not wanting to be that guy who's always in the bathroom. But this avoidance behavior actually makes your symptoms worse, creating more urgency and frequency in the long run. The fix. Urinate when you first feel the urge. Don't wait until it's desperate. For men with prostate enlargement, I recommend urinating every 2 to 3 hours during the day, even if you don't feel a strong urge. This practice of time voiding helps keep your bladder from overfilling. Maintain better bladder muscle function. Reduce the sense of urgency. Empty more completely because you're not fighting an overfull bladder. Set reminders on your phone if needed. Make it a routine. Mistake number 3, not emptying before bed. This seems obvious, but you'd be surprised how many men don't fully commit to this practice. Many men urinate before bed, but they do it hours before they actually lie down. Or they urinate, then sit and watch TV for another hour while drinking water or tea. The biological impact. If there's any urine in your bladder when you lie down, you're setting yourself up for nighttime waking. With an enlarged prostate, your bladder capacity is already reduced. Even a small amount of urine can trigger the urge to wake up and urinate. Plus, when you lie down, the distribution of fluid in your body changes. Fluid that's been pooling in your legs during the day redistributes to your core, increasing urine production. The emotional impact. Nighttime urination no cura is one of the most disruptive symptoms of prostate enlargement. It destroys sleep quality, leading to chronic fatigue, irritability, reduced cognitive function, increased risk of falls, especially in the dark. Negative effects on overall health. The fix. Follow this bedtime protocol. Stop drinking fluids 2 to 3 hours before bed. Urinate completely right before getting into bed. Use the double voiding technique. Keep a dim nightlight or motion sensor light in the bathroom for safety if you do wake up. Elevate your legs for 20 to 30 minutes in the evening before bed to help your body process the fluid that's been pooling in your legs. This simple routine can reduce nighttime bathroom trips significantly. Walter implemented this protocol and went from 4 nighttime trips to 1 or 2. Mistake number 2, using the shake and squeeze method wrong. Most men give a quick shake or squeeze at the end of urination to get those last few drops out. But the way most men do this is ineffective and can actually cause problems. The biological impact, aggressive shaking or squeezing, can irritate the urethra, cause minor trauma to delicate tissue, not actually empty the urethra effectively, lead to those embarrassing dribbles that happen after you've zipped up. The urethra is longer than most men realize, about 8 to 10 inches from bladder to tip. That last bit of urine can remain in the urethra after your bladder has emptied. The emotional impact. Post-void dribbling is one of the most embarrassing symptoms for men. That wet spot on your pants, the worry that people will notice, the need to constantly check yourself. The fix. Use the urethral milking technique. After you've finished urinating completely, place your fingers just behind your scrotum, the perineum area. Apply gentle, firm pressure, and slowly move your fingers forward along the underside of the penis. This physically pushes any remaining urine forward through the urethra. Then do 1 gentle shake or squeeze. This technique is much more effective than shaking alone and prevents post-void dribbling. For many men, it might feel awkward at first, but it works and it's far better than dealing with wet spots on your clothing. Mistake number 1, not staying hydrated because you're afraid of bathroom trips. And here's the biggest, most counterintuitive mistake of all. Many men with prostate symptoms deliberately restrict their fluid intake because they're trying to reduce bathroom trips. This backfires spectacularly. The biological impact. When you don't drink enough water, your urine becomes concentrated and acidic. Concentrated urine irritates your bladder and prostate. This irritation actually increases urgency and frequency. You're at higher risk for urinary tract infections. You're at higher risk for bladder stones. Concentrated urine can worsen inflammation. Paradoxically, being well hydrated with diluted urine actually reduces irritation and can improve symptoms. Additionally, dehydration causes constipation. Constipation creates pressure on your prostate, from your full rectum, making urinary symptoms worse. The emotional impact. Living in constant fear of needing a bathroom is exhausting. Restricting fluids doesn't solve the problem. It just creates a different set of problems while reinforcing the anxiety. The fix. Drink 6 to 8 glasses of water throughout the day, with the majority consumed before 3 to 4 p.m. Your urine should be pale yellow, not dark or concentrated. Stay well hydrated during the day, then taper off fluids in the evening. As we discussed, this balanced approach gives you the benefits of hydration without excessive nighttime urination. I had a patient who was drinking only 2 to 3 glasses of water per day because he was afraid of bathroom trips. When he increased to proper hydration, front-loaded in the morning and afternoon, his urgency and frequency actually improved because his urine was less irritating. I want to pause here and acknowledge what you might be feeling. If you're dealing with prostate and urinary symptoms, I know this affects so much more than just bathroom inconvenience. It affects your sleep, your energy, your willingness to travel or socialize, your confidence, your sense of independence and control over your own body, the constant awareness of where bathrooms are located, the embarrassment of excusing yourself repeatedly, the worry about wet spots or accidents, the exhaustion from broken sleep. These are real losses and they matter deeply. But I need you to hear this. You don't have to accept severe symptoms as inevitable. Small changes in your bathroom habits can make a significant difference. The 7 mistakes we've discussed are so common that most men make several of them without ever questioning whether there might be a better way. But now you know better. And knowing better means you can do better. I've been working with men for 12 years. I've seen patients in their 70s and 80s dramatically improve their symptoms simply by correcting these bathroom mistakes. Walter, the retired pilot I told you about, made these changes at age 71. Within 3 months, he told me, "I feel like I have my life back." He's not unique. This can be you. Your prostate symptoms don't define you. They're not a reflection of your worth or masculinity. They're a medical condition that responds to proper management. And proper management starts with the simple daily habits you can control. Be patient with yourself. Give these changes time to work. Most men notice improvement within 2 to 4 weeks, with continued progress over the following months. You deserve to sleep through the night. You deserve to travel without fear. You deserve to live your life without constant bathroom anxiety. That's possible. And it starts with changing these 7 bathroom mistakes. So here's exactly what I want you to do right now. First, go through the 7 mistakes we discussed and identify which ones you're currently making. Be honest with yourself. Second, pick the 2 easiest changes to implement immediately. Maybe it's sitting down to urinate and taking your time. Maybe it's the bedtime protocol and proper hydration timing. Don't try to change everything at once. Just pick 2 and master them this week. Third, after you've successfully implemented 2 changes, add another one. Build these habits progressively over the next month. Fourth, keep a simple bathroom journal for 2 weeks. Note how many times you urinate during the day and at night. Note the quality of your stream. This gives you objective data to see your progress. Fifth, if you're experiencing significant symptoms, difficulty starting urination, very weak stream, inability to empty, frequent infections, or any other concerning issues, see a urologist. These bathroom habit corrections work best as part of a comprehensive approach that might include medical treatment. And finally, if this video helped you, I need you to do something for me right now. Hit that like button. Subscribe to this channel so you don't miss future content on prostate health and men's wellness. And drop a comment below. Which of these 7 bathroom mistakes were you making? I read every comment, and I'm genuinely here to support you. Here's what I know after 12 years of helping men with prostate health. Small changes in how you use the bathroom can create significant improvements in your quality of life. You can be 70, 75, 80 years old and still sleep through most nights, still travel confidently, still enjoy social activities without constant bathroom worry. That's not reserved for men with good genes or mild cases. That's available to most men through proper habits, medical care when needed, and refusing to accept unnecessary suffering. Walter thought his bathroom struggles would define the rest of his life. He thought his days of confident travel and uninterrupted sleep were over. He was wrong. And if you think the same thing about yourself, You're wrong too. Your bathroom habits matter. Your daily choices accumulate into significant outcomes, and you have more control than you've been led to believe. It starts with something as simple as sitting down to urinate instead of standing, taking an extra minute to empty completely, staying properly hydrated, following a smart bedtime routine. These aren't complicated medical interventions. They're basic adjustments that respect how your aging prostate actually functions. Thank you for being here. Thank you for taking your health seriously. Thank you for believing you're worth the effort to make these changes. I'm Dr. Nerita, and I'll see you in the next video. Now go fix those bathroom habits and reclaim your quality of life.